Hi everyone, thanks for stopping by today. Today's video is a little bit special because I got a 2-in-1 for you. I'm going to be talking about how I am 2 weeks on testosterone and how I am 6 weeks post-top surgery with Dr. Garramone. I do just want to say before we get started, I am going back to work this week, so I'm going to be down to just doing one video a week. I'm going to try to get videos out on Tuesdays. But if I don't get it out on Tuesday, it'll be a couple days after. I'm going to try somewhere between Tuesday and Thursday to get my videos out for you. Okay, so the first thing we're going to talk about is my chest and how I'm doing with that. I will show you the B-roll clip of it after I'm done talking, and after I'm done talking about my testosterone update as well. So stick around towards the end and you'll get to see that. As far as the top surgery healing process, everything's basically settled into where it's going to be for a while. I haven't really seen very many changes. There's been a few developments with like the left nipple a little bit. It's having a little trouble healing, but it's nothing that's going to be that big of a deal. I'm sure it'll all clear up, and I'll point that out in the B-roll. Other than that, my reach has gotten way better, so I'm going to just randomly show you here how high I can go. So if I'm reaching like directly in front of me, I can go to about here. I know that looks bad. I can go to about there, and then I get a little bit scared to reach up higher. The sides, I go to about here, and then I can kind of feel pulling, but I don't think it's a problem. I just don't want to stretch the scars at all, so I'm just gonna not reach higher than there for a little while. That's about the only stuff as far as surgery. I'm just going to jump right into the next part, talking about my testosterone shots. So I've taken 3 testosterone shots. I take them on Mondays, and I take them at about 10 a.m. I'm trying to get them all done at around the same time of day. I just heard that it's better for hormone balancing and stuff like that. There hasn't been too many changes, so I'm just going to go into the small things that I have kind of noticed, and I'm not really sure about some other things, so I'm going to squeak those in at the end here basically. The first thing I'm going to talk about is when I was taking a bath yesterday, I noticed that there was a few like longer, darker hairs on my like upper thighs, which weren't there before. I'm almost positive they weren't there before. The thigh hair is usually pretty fine and very blonde. My leg hair from the knees up is like super blonde. You basically can't see it unless you're like squinting, looking really hard. But there was a few bits of hair that were like, basically they're the same thickness as like the hair on my calf, which you know how most hair on people's legs is always thicker and longer. It kind of is coming like that up on my thigh now. Next thing I'm going to talk about is my face structure. I'm not sure if there's much of a difference. The last few days when I've taken selfies to send to my friends, I've just been looking and something just seems a little different. I don't know if it's actually anything has changed or if my brain is just like tricking me into seeing that, but I will put up some comparison photos for you. I'll put them up here just to show you if there is any type of difference. I'm not sure. I haven't taken the photos yet, so I haven't gotten a chance to compare them. Other than that, my skin, as you can see here, I have gotten a bit more acne. Although my face hasn't, like my skin in general hasn't gotten oilier. I hear a lot of guys talk about how tea makes their skin oilier. That I haven't had a problem with yet, but I have had a bit more acne, as you can see here. As far as energy goes, I've been pretty full of energy, honestly. I've been not really bored. It's just, I just keep wanting to get something to do. So I've been walking around the house, cleaning things up and sorting stuff and just cleaning basically, because there isn't really much that I can do at this point. Perhaps it'll be good once I'm back to work towards the end of the week, just to let out a little bit of energy. I did do my first workout after surgery yesterday. I kept it super light though. I just did like 10 push-ups, and I didn't do them off the floor. I did them off my desk, which is over there, and it's only like this high, so it just helps with so that's not as hard. And I've always been pretty skinny and not very able to do push-ups in the first place, so I didn't want to hurt myself because you're supposed to ease your way into working out at the 6-week mark, and then I did some like mostly stretching other than that, and then I did some sit-ups. I think I did 40 sit-ups, but that was about it, so it wasn't anything too bad or anything like that, but I did have a decent amount of energy to do that. I don't know if I felt stronger or anything like that. I have heard people say that in the first few weeks they start to feel stronger, but don't really see any muscle differences. I think maybe I might have felt a little stronger, but not enough to really tell all that much. Other than that, the only thing else that I've kind of noticed is I think my voice has dropped just a little bit, and I have this app on my phone where it like records how high pitched your voice is and stuff like that. So I did that the last few weeks on the day that I took my shot. This week I did do it the day later because I forgot about it. But since I'm mentioning it, I'm gonna put those pictures in here too. As you can see, it's not much of a difference, and there is some like, it's not the best app or whatever, but it is some sort of baseline just so I can kind of see overall. And I think it has dropped a little bit. As I'm sitting here talking, I can feel that my voice is a little bit raspy, I guess you can say, and that my throat is a little bit sore, just a tiny bit though. Like, I'll probably start getting some changes here in the next week or two is my guess, just based on how my throat is physically feeling as I'm trying to talk at the moment. But this is about the most I've talked in quite a while, because I don't sit here and like rant about anything when I'm stuck at home all that much. So I think that's about it. I'm going to insert the video here of how my chest is doing and point out how everything's healed and how things are feeling and stuff. So I'm going to insert that right now. I guess I'll just start out with how the scars are feeling. So let's see here. It's a little bit more feeling, I guess. It's not like, it's hard to tell, but like it feels like normal skin almost to the touch. Like you can feel a little bit of a difference, but it basically feels like normal skin. Same with the nipples mostly. This one has a bit of a dark spot. I think all that is right there is a stitch that hasn't, like, that is kind of stuck under the skin, so that hasn't dissolved yet. I'm assuming that's what it is. I'm sure it'll go away. This one has a little bit of like bumpiness on the top here where I'm touching, right here, like around the scar of it. This one is a little bumpy, but not bad at all. This one is just, I wouldn't say puffy, it's just a little raised. So here's how the scars are. I'll show you a nice good look around the chest. That. As far as feeling, all this, let's see, it's still a bit numb here, but I can feel all this. I can feel that. I can sort of feel under the nipple. This side, I got a bit more feeling over here. I can feel all that. If I go this way, I can feel that. I can feel that, yeah. So I can feel all that. And like under the scar, you can feel it, yeah. But there's just some like discoloration around the scars that I wasn't really expecting. Like it kind of, like here especially, you can see like the dark spot. Like it's not just one perfect line all the way across, which I kind of thought it was just like the line, not the discoloration around it. But I've never had surgery before, so it's not like I knew what to expect. There is the scarring on like the bottom bit of the nipple here, and here is starting to fade a little bit, so that's nice. I haven't gotten the color back in my nipples yet. I'm really excited for when that comes back. But I just really like the way it's going so far. But yeah, I think that's all I've got to say. I'm just gonna give you another quick look before I go, all the way over here. Sorry, go back to the middle. Just like that. And then one last thing, this nipple does, if I can see if I can get some view for you. I'm not sure if that's going to show or not, but the protrusion is really good on this one. And then on this side, it's almost flat, like there is some. And it had better protrusion before, and then it kind of flattened out. So I don't know if it's going to come back or not. But this one is taking a bit longer to heal. Like the top bit, like from here up of the middle part of the nipple, is like normal color, and then the bottom is like sort of red. I'm just a little irritated, it looks like. But yeah, I think that's all I have to say. So we'll just get back to the video. Okay, that's all for the video. So go ahead, like and subscribe to my channel if you want to see more videos. I'm planning on doing updates for my top surgery and my testosterone pretty regularly. So if you want to see more of that, go ahead and check it out. I do got some playlists that I'll link here at the end of the video. But other than that, I don't have anything else to say. Follow any of my social medias and stuff like that. Links are all in the description. Have a nice day, week, month, however long until I see you again. Alright, bye.